Good afternoon. My name is Jade Salvatore. I am a nurse at a local community hospital in Massachusetts, and I'm also a student nurse studying at Regis College for my NP. I am here in support of the House Bill 4879. I have been personally and professionally affected by mental health. A few years ago, at the age of 15, my niece suffered a mental health crisis. She was transported to our local hospital where she sat there for over a week. With little to no resources, she was afraid and mostly alone. Right now, in our ERs, people can wait weeks, sometimes months, to be transported to an appropriate level of care. This shouldn't be happening. If this bill is enacted, then we would increase our licensed personnel in our ERs in our hospitals in Massachusetts. In 2020, the second leading cause of death in children aged 10 to 14 was suicide. This statistic is astounding. This shows me that there's not enough resources. This statistic was provided by CBS Boston 2022. If this bill is enacted, we would have school-based mental health services in our schools in Massachusetts. We would also have a 24/7 in-call hotline for any student suffering from a mental health crisis or just mental health issues in general. If this bill is enacted, an online portal would be created where clinicians could go to see real-time numbers, real-time figures. A clinician can go in and see when a patient has been assessed, what their disposition is, how long they've been in an ER or an institution waiting for their best level of care. This online portal would also show all psychiatric beds in real time available in Massachusetts. This would be a great feature. This would help with disposition, and it would be zoned by geographics. According to the Department of Public Health, our ER bordering times for mental health are up 400% in the last 2 years. This can't happen. We don't have the resources in our ERs for this. According to CBS Boston 2022, there are 444 beds available for children in Massachusetts, psychiatric beds. Of those beds, 89 of them are offline due to short staffing. If this bill is enacted, it would increase licensed personnel within facilities, within hospitals, within ERs. It would increase our resources in schools, in our community, in our ERs, and in our hospitals. We need to act now. This is a real-time issue here. Our youth is suffering. I'd like to thank my legislation for listening. Take care.